Hi, I'm Dr. Michael Tager with the Kirkland Thyroid Institute, where we specialize in helping people overcome chronic thyroid disorders. Most people who come to my office have already been to 4 or 5 other doctors, unfortunately with little to no help. The reason we're able to help those patients is the comprehensive evaluation and testing that we do. Now today we're going to be talking about secret number 10, and that has to do with gut and liver problems. Now in past DVDs we talked about how there can be conversion problems where your body can't convert T4 into T3. So when your body makes thyroid hormone, it's at T4 is the inactive form and T3 is the active form that's actually going to go into the cells and create metabolic activity. The problem is that your body makes mostly T4 and a very little amount of free T3. So your body has conversion pathways that will actually convert more of this inactive T4 into T3. There's basically kind of 4 different pathways or 4 effects that can cause conversion problems. The liver and the gut are involved in conversion, and that's what we're going to be talking about today. And then in the past DVDs we talked about the adrenal gland problems and blood sugar problems and how that can interfere with proper conversion. So today we're talking about the gut and the liver. So let's talk about the liver first. Your liver, as I mentioned, is one of the organs that will actually convert T4 into T3, but if you have a liver problem, you're going to have an underconversion issue and you're going to get low thyroid symptoms. So the question is, how do you know if you have a liver problem? Well, you have to do a test. There are blood tests that can be done that will let us know if you have issues with your liver. The values would either be functionally low or lab low. And based on those readings, we would, if that's the case, we would put a patient on a detox program for the liver, all natural therapies to help the liver function better, and then we would see change in a patient's symptoms and also in their blood levels. Now, let's talk about the gut. The gut is very important also to convert T4 into free T3. Now, how do you know if you have a gut problem? Well, you have to run tests. It always comes back to doing the proper tests. So you have to do some special blood tests, and you also have to do some stool-based tests. And based on these tests, we'll be able to determine what's going on in the intestines. We often find chronic infections like yeast infections, we find parasites sometimes, we might find a virus, just different things in the gut that aren't supposed to be there. Bacteria, abnormal bacteria is common. And then based on that, we would again do all natural therapies to help your body rid you of those problems so that the gut can return back to proper function so that you can get better. So from these past few DVDs that we've done, I hope you're really getting the sense of how interrelated all of the organ systems are. For instance, a low thyroid can cause a sluggish gut. A sluggish gut can become more susceptible to infection and food allergies. Now, when you have a gut problem, you can also end up with an immune problem, because if the gut is inflamed, it's going to cause your immune system to go into kind of a hyper mode, and it actually can start attacking tissues, including the thyroid. So that's why it's so important to do all the testing that's necessary to break these chronic vicious cycles that happen in the body. The reason that you have not gotten better despite your best efforts is you've not had the proper evaluation and all the testing that's necessary to determine the exact reason why your thyroid metabolism is not functioning properly. In our office, that's what we specialize in. So if you are ready to get better, give our office a call at 425-821-1101 and set up your 2 free visits.